Welcome to My Long Island TV. From Manhasset to Montauk, we have traveled our communities to bring you the following events. I'm your host, Waldo Cabrera. My Long Island TV starts now.
Hofstra University School of Health Sciences and Human Services was founded about 2 years ago. It was founded to help complement the School of Medicine, the School of Law, and to promote health careers for our students. Public health is kind of the centerpiece of our new school. This particular session is about minority health affairs. It's a conference on minority health affairs that began with an academic panel. The panel addressed some of the disparities on Long Island communities in terms of health that are by race and ethnicity.
National Public Health Week, which has been happening across the country since 1995, President Clinton actually declared the first week in April Public Health Week, can extend from anywhere to 1 to 7 days. We're actually doing a 7-day conference here. So today's event is the first Nassau County Minority Health Conference, and so Hofstra is partnering with the Department of Health here in Nassau County to raise awareness about issues related to minority health specifically. So even though Nassau County is one of the healthiest counties in the country, we have these pockets of poverty that exist that are often masked by how affluent our county is. Today's event is going to talk about what are some of the challenges, what the county's doing, what are some other organizations doing to build health equity, to kind of look at those disparities and say, why do they exist and what can we do to rectify them, to fix them, to eradicate them, so that everybody has access to health care, so that everybody has an opportunity to live a healthy life.
I was actually studying pre-med in undergrad, so I wanted to be an OBGYN. I started volunteering at the hospital and realized that this really was not the path that I wanted to go. I wanted to be more out in the community making a change, getting involved. That's how I found public health. I wanted to stay in healthcare, but I wanted to make more of an impact and more of a change on a ground level. I found public health, I started the program, and that's when I really started to realize what my interests are. And I found out that it was health disparities. I think first, the biggest thing is education. I don't think that everyone knows exactly what is minority health. I think that the communities that we consider minority health, or the selected communities in Nassau County that have the most health disparities, they need to know what's going on. I don't think they even realize that there is a big disparity. So I think the biggest thing is educating, to educate them to know that these do exist, and empowering them so that they can start making changes themselves.
We really want to connect the gap between oral health and systemic health. This is a very important issue within Long Island and worldwide now, and we're really looking at providing oral health care screenings for over 100 high school students to help them better understand the connections between oral health and systemic health.
Last year when we first started National Public Health Week, we started small and we said, let's see how these new graduate public and community health students will get engaged. And they were so incredibly engaged. They talk about nutrition and access to clean water and kind of things that we may take for granted, that there are places both in this country and elsewhere that are still struggling with. Infant mortality, childhood obesity, all these things. And how not only is it affecting people's quality of lives, but it also affects the pocketbook. And so they talk about the return on investment of investing in public health. And I like to think of them as scholar advocates, because they're studying formally and they're looking at the data and they're looking at what works and they're looking at the problems, and then they're translating that into a language that communities can understand.